So now we will continue with embolism. So I've already mentioned embolism is a detached intravascular solid liquid or gaseous mass. It's carried by the blood to a distant site. So I have given the example of a thromboembolism earlier, whereas in a thrombus, a part of the thrombus, it gets detached and it is carried in the circulation into, and it finally it gets lodged in some of the smaller blood vessels, and the blood vessels, when it is occluded by this emboli, it causes ischemia and infection in that related tissue. So this process is called as embolism. So when we look in the types or the forms of embolism, there are various kinds. The most common one is the thromboemboli from a thrombus. Emboli coming from a thrombus. That's 90% of the total. Then also fat, air can get embolized, cholesterol or athermatous plaque, part of the plaque, bone marrow, then platelet can get embolized, then infective emboli, that is infective materials, in infective endocarditis, etc., the bacteria, the debris, it can get emboli. Then tumor emboli, then foreign materials can embolize, then amniotic fluid also can get embolized. Is forced into the uterine veins. Amniotic fluid is forced into the uterine veins at the time of delivery, and it causes respiratory distress. So these are the major types of embolism. And when it comes to the consistency of the emboli, there is solid, liquid, and gaseous. Solid is thromboemboli, it is a solid structure. Then atheromatous material, these are solids. Then tumor cell clumps, parts of debris from the tumor cells, they are solid. Then tissue fragments can embolize. Parasites can embolize, foreign bodies also, these are all solid emboli. Then liquid emboli, they are fat globules, amniotic fluid and bone marrow, all these are liquid emboli. And gaseous emboli, they are air and other gases which can get embolized. And depending on the infection, there is infected emboli and non-infected emboli. Infected emboli is a septic emboli, whereas non-infected emboli is called the bland emboli. And the source of all these emboli can be cardiac, arterial, venous, or lymphatic. And depending on the flow of blood, again two types are there. There is a paradoxical or crossed embolus and retrograde embolus. In crossed embolus or paradoxical, that means there is a mix of venous and arterial side. Example, in septal defects of the heart, there is a septal defect. Due to septal defect, the venous side and arterial blood gets mixed, and embolus can shift from a venous to a arterial side, that is closed embolus. And retrograde embolus, which travels against the flow of the blood. Again, here the metastatic deposits of spine from prostate. So prostate 3A is cancer of the prostate gland is occurring, and metastasis or transfer of this cancerous material from prostate, and it gets deposited in the spine through the pelvic plexus and the spinal veins, intraspinal veins. That is against the flow due to the increased pressure in the body cavity, especially when we cough and strain. Due to these pressures, these emboli which travels against the flow and gets lodged in different area. So that is retrograde embolus. We'll just focus on thromboemboli initially. So thromboemboli is from the systemic veins. It passes through the lungs and produces a pulmonary emboli. And if it's from the heart, it passes via the aorta to the renal, mesenteric, or femoral arteries or elsewhere. And from the atheromatous carotid arteries, it passes to the brain. And the atheromatous abdominal aorta, the thromboemboli, it passes to the arteries of the legs, producing peripheral arterial occlusion disorders, etc. So venous thromboembolism, we'll just focus on venous thromboembolism. The veins occurs in the veins of the lower legs, pelvic veins or upper limbs, and cavernous sinus in the brain. It also has the chances of getting a venous thromboembolism, and the right side of the heart is also having a chances of getting venous thromboembolism. And the significant effect of venous thromboembolism is the obstruction of pulmonary arterial circulation, because all these veins, it drains to the heart, right side of the heart, and then to the pulmonary artery. So the final effect will be in the pulmonary artery or the lungs, causing pulmonary embolism. So here I will just mention about two terminologies that comes along with venous thromboembolism in veins. That is thrombophlebitis and phlebothrombosis. Both looks similar, but it's different because thrombophlebitis phlebitis means there is inflammation of vein. So here the major symptom is the inflammation of vein. The inflammation of vein occurs first, and thrombosis is secondary to that inflammation. This condition is called as thrombophlebitis. First there is an inflammation and later thrombosis formed. Seen in, I think I have explained some thromboangiitis obliterans condition or the Burgess disease, I have mentioned it earlier. In such conditions, thrombophlebitis is seen. Whereas phlebothrombosis is a condition that occurs in the deep veins with minimal or absent inflammatory reaction in the veins. So this is the most common type, that is called as deep venous thrombosis, is a major type of phlebothrombosis. And usually pulmonary embolism is commonly seen in phlebothrombosis because this has the most chance of detaching and becoming an emboli. Dislodgement and migration of a thrombus is more seen in phlebothrombosis than thrombophlebitis, because in thrombophlebitis there is an inflammation of the vein, so the thrombus is more adherent. It is formed secondary in that inflammatory area. It is more adherent, so there is less chance of detachment in thrombophlebitis. Whereas in phlebothrombosis, there is more chance to get dislodged and form a thromboembolism, especially pulmonary embolism. Now we'll just see the types of venous thromboembolism. There is a superficial venous thrombosis and a deep vein thrombosis. So the most common type of venous thromboembolism is deep vein thrombosis. It occurs in the veins deep within the muscles of the leg, arms and pelvis. Whereas a superficial venous thrombosis, also called as a phlebitis or superficial thrombophlebitis, is a blood clot. It develops in a vein close to the surface of the skin. These do not usually travel, I mentioned earlier, travel to the lungs unless they move from the superficial system into a deep venous system. So if they move from the superficial to deep venous system only, there is a chance of an embolism. Otherwise, these are not much complicated. Now I'll just give a small description about the deep vein thrombosis. Deep vein thrombosis is a formation of a blood clot in one of the deep veins of the body, usually in the leg. I had mentioned the basic reasons in the previous slide. Starts in the lower extremity calf veins. So it begins in the calf veins. The calf veins, deep veins in the calf area, that is anterior tibial, posterior tibial and peroneal nerve, and it progresses approximately to involve firstly the popliteal, femoral and iliac system. And the symptoms are swelling in your foot, ankle or leg, usually unilateral, and there is pitting edema. The edema or the swelling, it pits on pressure. There is a cramping pain in your affected leg that usually begins in your calf region. There is tenderness, also severe unexplained pain in your foot and ankle. Then increased skin temperature and fever, and also cyanosis. So some less common or other symptoms include phlegmasia alba dolens and phlegmasia cerulea dolens. So phlegmasia alba dolens is milk leg or white leg. You can see in the picture. Thrombosis is only present in the major deep venous channels, but not in collateral circulations. So it causes, since the major veins are involved, it causes painful congestion and edema of the leg, and that's the appearance of the phlegmasia alba dolens, that is milk leg or white leg. Whereas phlegmasia cerulea dolens, it is painful blue edema because the thrombosis extends to the collateral veins. It is present in the deep veins, also the collateral veins also. So there is total congestion. So congestions, massive fluid sequestrations. That means the fluid is lost from the circulation, leading to edema. And usually the complication of cerulea dolens is venous gangrene. So there is a completely lack of circulation and leads to gangrene formation of the foot. So I'll just explain a couple of signs, clinical signs used in deep vein thrombosis. Common sign, you can see in the picture there is a forced dorsiflexion of the foot, and the person feels pain in the posterior calf or calf area or the posterior knee area. Then Moses sign is another test. There is on compression of the calf muscles against the tibia, the person feels pain. These tests are a bit risky since we are applying pressure. It can produce the detachment of the thrombus and cause a thromboembolism. So mostly these are being not done or done with proper precaution nowadays.